Stackhouse. By the way, that's a really cool name too, man. It's
Wait,
like
wait,
the
my
voice and the
parents.
name. That's awesome. Let's see, he's an insurance broker. Let's see, topic of discussion today is a review of Medicare annual enrollment. So everybody probably needs to know a little bit about that no matter what. Previous jobs, he's been in food service, he was a merchant sailor, health club sales and management, property and, I guess it's casualty? Casualty
Yes.
insurance? Okay. And then also financial services as well. There's a quote here from Zig Ziglar. If you help enough people get what they want, you will get what you want.
That's it.
I think that's a good quote. I like that. And then what sets him apart from others in business, care more about helping people the right way without focusing on getting the highest commission or more customers without regard for their needs. So, all right, Stuart, take it.
Thanks, Shane. So everybody's had 2 cups of coffee already, right?
Yeah.
If the person next to you decides to fall asleep, please poke them. I'm gonna pass around some of my business cards, but please keep the back side up. We'll go that way so they cross the middle. This is a small pamphlet talking about the Medicare. And then this is, take one off the top and the bottom, worksheets and a required form from Medicare.
Oh, boy.
My name again is Stuart Stackhouse. I'm an independent insurance broker licensed in the state of California, about 17 other states. My specialty is helping people, your friends, your family, yourselves, make the appropriate choice in their Medicare insurances. There is a lot of moving parts. My icon is a puzzle because there's lots of different pieces of the puzzle, but that puzzle changes every year. So we have to make sure all those pieces fit together. There are different parts to Medicare. So in the little book here, and I'll run through it, is a great primer. This comes from United Healthcare. It's not an advertisement for United Healthcare. It's the pamphlet that I think is the simplest introduction to Medicare. It makes it a little bit easier for people to understand. So Medicare is health insurance for people 65 and older, and some people under 65 who gain Medicare through disability. A catastrophic disability, or somebody who has been on Social Security for, in their 25th month, they gain Medicare. Medicare consists of 2 parts. It started in 1965. Part A is hospital, acute hospital, skilled nursing facility, oftentimes after you've been discharged from a hospital stay, it's not safe for somebody to go home, so we'll go into a skilled nursing facility, and that's often referred to as rehab. Then there's home health care, which is a skilled person, an RN, a physical, occupational, respiratory therapist that comes to somebody's home, oftentimes after they've been discharged for one of the first 2, to help them with wound care or physical therapy, getting set up at home because they can't yet go to the therapy location. And then hospice, which is end-of-life care, and which can either be done at home or in a facility. Medicare takes care of that part. For Part A, most of us don't have a premium. We've worked for 10 years, or 40 quarters is the term, and so we don't have to pay a premium for that, or we're married to somebody who did, and that covers for it. People who don't have the 40 quarters, who have emigrated, can purchase that from Social Security. Medicare is a division of Social Security Administration.
I didn't know that.
And that premium for Part A can be a little over $500 a month. Part B is what we use most of the time. Part B is our doctors, specialists, therapists, diagnostics, labs, imaging, durable medical equipment like hospital beds or wheelchairs or walkers, oxygen is durable medical equipment. And some medications which we refer to as Part B medications. And those are things that are very expensive, have to be administered in a medical setting by a medical professional, things like chemotherapy, infusions. There is one for somebody with macular degeneration that's an injection. And we're talking about $6,000, $7,000, $8,000 per administration. Part B does have a monthly premium. For most people, it changes every year, it's $174.70 a month, starting January 1st. We usually get that number sometime in late October or November. Part B pays roughly 80% of the bill. It does have an annual deductible for original Medicare Part B, and that's a whopping $240 next year, up from $226. So once somebody's paid that $226 or $240, then Medicare will then pay 80% of the Medicare allowed charges. If a doctor accepts what Medicare says that that procedure is worth, then they accept Medicare assignment. But, well, all doctors think they're special. Some of them think they're extra special. So if Dr. Smith says, I charge $3,000 for that procedure, and Medicare says, well, we paid $1,000 for that procedure, assuming that you've paid your deductible, Medicare would pay $800. You would pay the $200, but Dr. Smith, not accepting Medicare assignment, can charge up to 15% over that, which we call excess charges, and therefore Dr. Smith would send you another bill for $150, so 15% over the Medicare allowed. When Medicare started in 1965, insurance companies, in their wisdom, said that we can create a product that will cover what Medicare doesn't pay. And so Medicare supplements were created. Today, since 2010 in the Affordable Care Act, the government refers to them as Medigap plans. They cover the gap that Medicare doesn't pay. And today, there's plans A, B, C, D, F, G, K, L, M, and N. Nope, didn't mislearn my alphabet. So those plans are available today. Plans F and C are available to people who gained Medicare prior to January 1st, 2020. They pay the Part B deductible as well as what Medicare doesn't pay. A lot of people have Plan F. A lot of people are under the assumption that if I had Medicare and I don't have a Plan F, I can't get one. That's not true. If somebody was eligible for Plan F Medicare supplement, they can still get one. But Medicare supplements are different than most of our other medical insurances today. They're medically underwritten, so people can be denied a Medicare supplement. People like Medicare supplements because there's no network of doctors. About 80% of the doctors in the US accept original Medicare. So a plan with original Medicare would be good anywhere in the United States and her territories. The doctor also has to agree to accept you. So a large local medical insurance company combination, Kaiser Permanente, does not accept original Medicare. So you wouldn't be able to go see that doctor. Some doctors and hospital groups today aren't accepting people with original Medicare and a Medicare supplement unless they have a pre-existing relationship. In our area, UC Davis will only accept original Medicare. They don't accept what's called Medicare Advantage. I'll come back to Medicare Advantage in a moment. The Medicare supplements give people a lot of choice between where they want to go, doctors they want to see, because there's no network. They could have a doctor in medical group A, medical group C, medical group S, as long as those doctors will agree to see them. And they don't have to have a primary care doctor. I recommend that for people who like to get in the big truck and drive around after they retire. They spend months away from home. They can get regular care anywhere in the US. Medicare Part A and B don't pay for a few things. Primarily, Part D, prescription drugs, the stuff that you get at CVS or Raley's or Bel Air. A and B don't pay for that. So the government came up with a plan called Part D, prescription drug plan. And while it's not mandatory that you have one, if you are entitled to Part A and or you have Part B of Medicare, you're supposed to have one, unless you have other credible coverage, which might be through something like the VA, a retirement program through the state or the government or a union that pays at least as much as a Medicare Part D program would pay. California has 23 Medicare Part D plans offered by a number of companies, and each one of them offers a couple of different plans. But they all work the same way, whether it's a standalone plan or embedded in a Medicare Advantage. They can have a monthly premium, that they can have a deductible, which is regulated by Medicare, and next year can be as much as $545. There is an allowance that you share with the insurance company. It's kind of like having a bucket on the table that has $5,030 in it next year. And so when you come into Raley's and you pick up your medicine, you reach into the bucket and you take out your copay or your deductible and you pay the pharmacist. And you take your bag of medicines out to the car. As soon as you're going out the front door, the insurance company reaches into the same bucket and takes out the rest of the cost of the medicine and pays the pharmacy. There are preferred pharmacies and standard pharmacies and non-network pharmacies. The plans will pay for the preferred pharmacy. It costs you less because they have a better negotiated price on the medicines between the pharmaceutical company, the pharmacy, and the insurance company. Or there's standard pharmacies which didn't get as good a deal. Or if they're not in network, they won't pay anything. So that's 100% out of your pocket. The allowance can run out if you have some expensive medications, and some of them I don't like to see that come up, and they're currently under negotiations through the pharmaceutical companies, the federal government, and the courts, things like Eliquis, Jardiance, Januvia, the commercials you see on TV that are advertising prescription drugs that are only available if your doctor says you need them. They can be, Eliquis is about $750 a month. That's the retail cost. It's a blood thinner.
Oh, okay.
Not a medical professional, I just, overhear what
gotta
people tell
learn
me
about
that they have, right?
yeah.
So I type them in a lot. So the Eliquis is $750 a month. Remember, we have a $5,030 allowance. Well, you're gonna run out of that allowance before the end of the year. You then enter what's called the coverage gap. Used to be called the donut hole, but now the government says we don't have a donut hole. But if it walks like a duck and it talks like a duck, in that coverage gap, the pharmaceutical companies have said, we'll give you a discount, 75% off that retail price. So now your copay goes up to the 25%. Now, each one of those plans has something called a formulary, a list of medicines that they cover. And the government has about 4,000 medicines that are allowed to be on the list. But none of those companies cover all 4,000. So your medicine has to be on the list or formulary. Then they take and they divide that formulary up into different categories called tiers. Not these unless you have something like Eliquis, or Jardiance, or Januvia, or Xarelto. There are 5 tiers, 1, 2, 3, 4, and 5. You ever read a restaurant review? You see it in the newspaper, and it's got a dollar sign. Well, tier 1's $1 sign, all the way up to $5 signs. So they can be very expensive. Starting next year, we used to have something called the catastrophic phase, and the federal government eliminated that catastrophic phase, which meant that those are people who have really expensive medicines. So the insurance companies aren't going to absorb that cost. They spread it out to everybody. So next year, people's prescription drug premiums have gone up by quite a bit. So I passed around my card. On the back of my card is a place for a list of medicines. One of my specialties is helping people figure out which plan will estimated cost them the lowest amount of money next year. In 2025, they've taken that and they've lowered it to a $2,000 out-of-pocket cap. So your deductible and your co-pays will be lowered to $2,000. What do you think that's going to do to the monthly premium?
Go up.
It's going to go up.
That's a low
So,
deductible.
I haven't registered this event as a sales event, so I can't talk about specific numbers other than what the government gives out. But if you'd like to meet, I can go over that. Check with your friends, check with your parents, see what happened, because a lot of people have blinders on. I've had it, it's worked, it covers my medicines, and they don't look. It could cost them hundreds or thousands of dollars to not check on this.
So can you have a medical plan that does not include prescriptions?
Oh, sure. It's not
Is it-
required.
Is it greatly different in premium to do it?
So there would be no premium because you don't have that. So what I've talked about so far is original Medicare, Part A and B, that's the red, white, and blue card, and a Medicare supplement, which is offered by multiple companies in the different alphabet soup that I talked about, and then a prescription drug plan. And there's 23 varieties. But it's not mandatory. Just if you don't have one or you don't have credible coverage, the government will give you a penalty when you finally decide to get one. And that penalty is 1% of the national average premium for every month that you didn't have it, that you could have. So I just enrolled a lady last week. She's 86 years old. She hasn't had one for 20 years.
Oh my goodness.
Her monthly penalty is going to be about $70 a month on top of her plan
That's
premium.
added to her.
So,
now.
And she has a penalty because she didn't have one?
because she didn't have one and she
Yeah.
didn't have other credible coverage. She just, I don't take any medicine, I'm not going to get one. Now she takes medicine. When they did that, they came out with a plan called Medicare Advantage. Those are also offered from a insurance company. And they said, we do regular health insurance. We do it for the government, for their plans. We do it for United Healthcare, things like that. And so they created Medicare Advantage, which is basically where people say, I want you to take my healthcare dollars from Medicare, pay it to the insurance company, and I'll agree to their terms and conditions. There's
Is that an advantage?
an Advantage plan.
Is that a
It can be.
disadvantage?
Everything's individual, so it really depends on that person. So there can be a plan, there's 13 plans in El Dorado County, there's 43 in Sacramento, there's 9 in Amador County, there's 26 in Placer. I represent everybody but Kaiser. But the other paper that I set out is a way to compare those different Medicare Advantage plans. And what I look at is, what's the impact of your prescriptions on a monthly basis? Which one has the lowest cost? Is your doctor in the network, if you care? What's your maximum out-of-pocket or your maximum medical financial risk utilizing that plan? And then there's a whole bunch of other stuff that they advertise. This is free, you can get that, you know, we'll give you dog food, we'll give you all kinds of things. Is that really important compared to the first three? And if it is, which plan has those other things if they're comparable with the first three? It's a great tool that I created to help people compare. And lastly, the other page is a scope of appointment form, which is required by Medicare so that when somebody meets with me or another insurance professional that does Medicare, They know that they're meeting with an insurance professional. They're there to talk about just the things they check off. So Medicare Advantage, prescription drug plan, Medicare supplement, ancillary products like dental. And then we keep that on file for 10 years, and so far I've shredded a bunch of them. Any questions?
Yeah, Calvin. What sickness should I get so it fits the plans?
I prefer none. You know, keep on going the way you're going, Bob.
One quick question that I think is important. What geographical areas do you cover?
I cover the state of California and 17 other states.
Okay, is Illinois one of those states?
It can be, no, I have to add Illinois. I'm always happy to talk to people, but it's very easy to add states, and it's usually because my customers here have moved there.
So I keep getting calls for this, but I'm 54, and they keep saying, oh, I should still be able to talk to you, but I don't need to worry about this right now, right?
So don't answer the calls. Don't give them any information.
I don't.
For the most part, those calls are illegal.
Okay.
We're not allowed, I'm so highly regulated, I can't hand somebody my business card who's 65 or older unless they ask for it. You couldn't tell me that your husband wants to talk to me and here's his phone number, please call. They have to reach out to me first. I've got that stupid form that I have to keep on file for 10 years that in my personal view doesn't prove anything. I'm here to help people. That's the number one reason that I'm here. And if it works out and I can help them, and then they decide to work with me with one of the insurances that I represent, I'll get what I want.
So and I know like my husband just turned 65, but he still works for a company. And so this is where there's this question, he still needed to sign up for Medicare, and not use it.
He doesn't need to sign up for it.
Because I would keep, okay, so let me finish my question. I was told that you have like 3 months to sign up before and whatever, how many 3 months afterwards. But if you don't sign up for it, later down the road, when he leaves working, because he has health insurance through his work, and he goes to sign up for it, then there is some penalty.
No, well, if you don't have other credible coverage,
He currently does,
Yeah.
but when he retires, he won't. And that's when he goes, he should not get a penalty.
right, he won't get a
had
penalty
credible coverage.
because he has credible coverage today.
Right,
And therefore, I don't recommend people sign up for A or B when they turn 65, especially if they have a health savings account through work. If somebody has Medicare, they can't contribute to a health savings account. So that stops it. So, and it's actually Part A is retroactive for 6 months. So while you sign up for it at 65, it starts 64 and a half. So you have to stop contributing to a health savings account. So I'd be happy to talk to anybody. I look forward to doing a one-on-one with everybody. Please call me with questions. I'm also the assistant greeter for 3 months out of the year at Walmart. And to explain that, I have a table or a kiosk at the front door Monday through Thursday mornings from 9 to 1, where I say hi to everybody that comes in and bye to everybody that goes out. But I'm there to help them and gain customers for their Medicare insurance.
Thank you.
Thank you for listening, everybody.